Good morning, my dear students. Today we will be discussing about a new antibiotic, that is fluoroquinolones. Before going into the topic, let's see the history of fluoroquinolones. It was in 1962, a scientist named as George Leisure discovered nalidixic acid. He named this acid as quinolone. Now, this discovery was made during the synthesis of chloroquine. What is chloroquine? Or chloroquine is an anti-malarial drug. During the synthesis of chloroquine, he discovered nalidixic acid. When he added fluorine atom to nalidixic acid, we developed the fluoroquinolones, and this was shown to have gram negative activity. And finally, this new antibiotic fluoroquinolone was used. After the discovery of quinolones, it was found that it was very useful in treatment of UTI, that is urinary tract infections. Later on, our fluorinated derivatives, that are fluoroquinolones, were also very active bactericidal agents, and they were found to have concentrated level in blood and tissues, which improved their antibacterial spectrum. So, when you speak about the spectrum of bacteria here, they are more active against gram-negative bacteria. Coming to the mechanism of action. To the mechanism of action of fluoroquinolones. Now, fluoroquinolones are all bactericidal agents. Their mechanism of action is by inhibition of replication of bacterial DNA, and this is done by inhibiting two enzymes, DNA gyrase and topoisomerase 4. As a result, what will happen is inhibition of replication of bacterial DNA. Now, this fluoroquinolone enter the cell through passive diffusion, that especially through water-filled protein channels named as porins. Once they enter into the cell, they come and bind to the DNA gyrase, which is otherwise named as topoisomerase 2 and topoisomerase 4, which is required in this bacterial growth and reproduction. When they bind to these both enzymes, there is inhibition of replication of bacterial DNA. So, in short, if you ask what is the mechanism, it is by inhibiting two enzymes, topoisomerase 4 and DNA gyrase, thereby leading to the inhibition of replication of bacterial DNA. Now, if you look into each function of the enzymes, inhibition of DNA gyrase will lead to the or will prevent the relaxation of positively supercoiled DNA, and that is required for normal transcription and replication. While inhibition of topoisomerase 4 is required, will interfere with cell division, and thereby interfering the separation of the replicated chromosomal DNA. And finally, there is inhibition of bacterial DNA, replication of bacterial DNA. As a result, the bacteria dies off. This is what happens in the what will happen with fluoroquinolones. The last line is they can enter the cells via porins. I told you that is water-filled protein channels known as porins, and are used to treat pathogens that are gram-negative, which include Legionella, Pneumophilia, and Mycoplasma. The other picture on the side will show you the yellow-colored fluoroquinolones entering into the cell through porins, inhibiting DNA gyrase and topoisomerase. Now, DNA gyrase are more specific for gram-negative organism by uh, mm, topoisomerase is very specific for gram-positive organism. So, fluoroquinolone, DNA gyrase, and topoisomerase 4. Flow mechanism of action will be clear when they come and bind to both these enzymes. Inhibition of replication of DNA. The one word mechanism in one word, if you say ask me what is the mechanism of action, is DNA replication, inhibition of DNA, bacterial DNA replication. Coming to the resistance, how all our fluoroquinolone will come into resistance. Now, resistance are mainly due to one or more point mutation in the quinolone at the binding region. Okay, binding region for which one? For the target enzyme. or to a change in the permeability of the organism. If the porine channels are becoming very thick, if the channels are very narrow, our drug cannot enter. So change in the permeability of the organism can also lead to resistance. Once there's a resistance to one fluoroquinolone, will confer cross resistant to all the other members. So these are the reasons for resistance, either by point mutation or change in permeability. Now, as I told you, point mutation, where all mutation can happen? Mutation in the bacterial topoisomerase 4 and DNA gyrase, which will prevent the fluoroquinolone from binding into these enzymes, and the replication will not take place. And also, there can be efflux pump, as you see in the picture, efflux pump, where once the fluoroquinolone enter the cell, these pump will exit it out very fast or throw these drugs out very fast before the action comes into the place. So bacterial modification to an efflux pump, which will allow bacteria to pump out the fluoroquinolone out of the cell. This is also another reason for resistance. Classification of fluoroquinolones. The introduction of background part. The first generation fluoroquinolones are nalidixic acid. They had an activity, or the spectrum was against gram-negative organism. The second generation included norfloxacin, ciprofloxacin, ofloxacin. The three drugs that you should remember under second generation includes norflox, ciplox, and ofloxacin. Here also the spectrum is gram-negative organism with very few gram-positive coverage, that is Staph aureus, and some atypical organism. The third generation includes levofloxacin, sparfloxacin, moxifloxacin, and gemifloxacin. The spectrum of third generation includes same as that of the second generation, with an extended spectrum for gram-positive organism. That is, the coverage, they are becoming broader and with some atypical coverage. Fifth one, provafloxacin, had the same with a broader anaerobic coverage. Okay. So there are four generations for fluoroquinolone, one, two, three, four. The first one is always our first discovered drug, that is nalidixic acid, and then comes the our original drugs under two, three, and four. Coming to the pharmacokinetics of fluoroquinolones in whole, okay, where they are well absorbed orally, and the bioavailability is equal to that of IV or parallel preparation, about 80 to 95 percentage. The half-life is about 3 to 10 hours. Now if you see, oral absorption is hindered by divalent cations. So whenever we divalent cations, which include antacid, which contains magnesium, calcium, and aluminum. So whenever we give oral preparation of fluoroquinolones, it should be noted that this patient does not have any antacid syrups, which will decrease the absorption of fluoroquinolones. Then most of the fluoroquinolones will be eliminated, or they are eliminated out by renal system. So those patients which have kidney problems, the dose should be adjusted. Here, our fluoroquinolones will not cross the blood-brain barrier. So any meningitis cannot be treated with fluoroquinolones because they have very limited CSF penetration. Coming to the distribution, as I told you, the post-antibiotic effect is more in fluoroquinolones because they get distributed and stored in these places. This concentration, which are which are present in more amount accordingly, are the prostate tissue, stool, bile, lung, kidneys, neutrophils, and macrophages. While this concentration very less, which are present in lower quantity, includes prostatic fluid, bone, and CSF. The effect, those bacteria which affects the system with concentration more can be easily eradicated, not eradicated, can be cured. Okay. To the drug interaction. In my pharmacokinetics, I told you antacids along with fluoroquinolone will decrease the absorption. Along with antacid, other substances are includes food and iron. If you prescribe food, iron, and antacid, the absorption of fluoroquinolones will be decreased. Also, there is enzyme inhibition by theophylline, warfarin, and caffeine. That is our but fluoroquinolones will inhibit the enzyme and lead to the toxicity of theophylline, caffeine, and warfarin. So these drugs should not be given in combination. Third interaction is NSAID may increase CNS toxicity and lead to seizures. And the picture shows that theophylline warfarin are metabolized by P450 cytochrome, but Ciplox will inhibit this metabolism and their level increases. That is what is shown. Serum concentration of theophylline warfarin and cyclosporin, which require metabolism of P450, is inhibited by ciprofloxacin. As a result, their serum level increases. So these drugs should not be combined together. Drug interactions. I told you one is about this enzyme inhibition. So those drugs which increase the level of fluoroquinolones, that is here I am talking about fluoroquinolones. This will be increased by NSAIDs and corticosteroids, leaving apart theophylline. Just remember NSAIDs and corticosteroids will increase fluoroquinolone level. While I told you by enzyme inhibition, antidepressant imipramine, caffeine, theophylline and warfarin's level will increase because of inhibition of fluoroquinolone, inhibiting the metabolizing agents. Okay. So special note should be made when you combine any fluoroquinolones with these drugs. Or uses of fluoroquinolone as a whole, okay, in general. First one, UTI and prostatitis. As I told you, fluoroquinolones are active against gram-negative organism. Most of the organisms causing UTI and prostatitis are usually gram-negative. So the first and foremost and common indication for fluoroquinolones includes UTI and prostatitis. Since they have the property of depositing inside the prostatic gland, they very effective against prostatitis. Second, STDs. STD means a sexually transmitted disease. A 70 course of afloxacin or sparfloxacin for chlamydial infection can help to relieve the infection. Or else for PID, pelvic inflammatory disease, a 14 days course of afloxacin can also decrease pelvic inflammatory diseases. The third use, GI, gastrointestinal and abdominal infection. This is also usually by gram-negative organism. So they are effective against travelers diarrhea, cholera, enteric fever, and shigellosis. Fourth use, that is respiratory tract infection. Here the third and fourth generation, usually where there is a combination of gram negative and gram positive. Both fluoroquinolones have excellent activity against the against streptococcus pneumonia. They are also very effective in clearing H influenza and Moraxella catarrhalis. Plus, they are effective against Pseudomonas in cystic fibrosis. So, fourth uses RTI or respiratory tract infection. Fifth is bone and joint osteomyelitis. The duration of the drug will take about weeks to months. While in diabetic foot, there's a combination of anti-anaerobic agents should also be used. Other uses of fluoroquinolones include multi-drug resistant TB and prophylactically in neutropenic patient, where some fluoroquinolones helps to increase the blood level count level, so it can be neutrophils level, so it can be given in patients those who are neutropenic. Side effects. Usually, our fluoroquinolones are safe antibiotics, but some patients experience few side effects. Under GIT, it is usually the most common nausea, vomiting, diarrhea, and also antibiotic associated colitis, where they have diarrhea. Okay, this is the most commonly seen side effect. Plus, the CNS level, they will have confusion, insomnia, dizziness, anxiety, and seizures. This is due to the displacement of GABA from its receptors. So a special note should be seen that when patients prescribed fluoroquinolones will come and mention they have some dizziness and anxiety, this is nothing because of fluoroquinolones in itself. Some of the drugs will have property of extending or prolonging the QT interval in the ECG, leading to torsade pointers. This is the most common side effect under cardiovascular system. A special note about fluoroquinolones in growing children, they may damage the cartilage resulting in arthropathy, but that's reversible and may be used in pseudomonal infection where benefit outreaches the risk. only where there be require fluoroquinolones in children should be prescribed. So it is always better to avoid fluoroquinolones under the age of 18, and if only the benefit will be more than the risk, we can prescribe fluoroquinolones in children. Otherwise it is contraindicated in children less than 18 years because it may damage the growing cartilage. Another one of the most common side effects or adverse effects seen with fluoroquinolones include tendinitis and tendon rupture. Even though rare, it is a serious condition. And then, few milder side effects seen are phototoxicity. Patients are avoided to excessive sun exposure, leukopenia and eosinophilia, plus mild elevation in transaminase. Showing fusiform swelling that is seen at the end of the tendoachilles tendon, which indicates a partial tear in the tendoachilles tendon. Achilles tendon. This is because the patient was on fluoroquinolone, went outside the sun. That is why those sunburn lesions have been seen on the face and the neck region, which was exposed to the sun. Plus, the rarest side effects, that is tendinonitis, again seen as a fusiform swelling under the tendon, Achilles tendon. Contraindication in children, not so absolute, but it is always mentioned to in a it is not advised to give fluoroquinolones to children. As I told you, growing cartilage may be damaged. It is contraindicated in pregnancy, lactation, epilepsy and QT prolongation conditions. Those patients with serious condition. As in the picture, you see the cartilages are destroyed, and there is a decrease in the height of the child. Most commonly used fluoroquinolones in detail. So most commonly used that you will come across is ciprofloxacin. This ciprofloxacin, it belongs to the second generation fluoroquinolones, and they are, as I told you, they will be very active against gram-negative organism, especially Enterobacteriaceae, H. influenza, M. catarrhalis, that is Moraxella catarrhalis, Campylobacter, Pseudomonas, and Neisseria gonorrhea. They are active against all these gram-negative, plus some intracellular pathogens, which includes chlamydia, mycoplasma, and tuberculosis, plus Legionella and Brucella. Their activity against gram-positive is very less. So, usually they are prescribed for UTIs and prostatitis. Okay. Rapid bactericidal activity and high potency. As I told you, they have a long post-antibiotic effects on and post-antibiotic effects because of their distribution. They are active against Enterobacteriaceae, Pseudomonas, and Staph aureus. Another property of ciprofloxacin includes low frequency of mutational resistance. The property of resistance is very less with ciprofloxacin. Plus, intestinal streptococci. They are active against or protective against intestinal streptococci, and anaerobes are spared. Other activity includes they are active against beta-lactam and AG resistant bacteria. Plus, they are active at acidic pH, less active at acidic pH. These are the properties of ciprofloxacin. Coming to the clinical uses of ciprofloxacin, UTI, that is gram-negative bacteria causing UTI, osteomyelitis due to Pseudomonas aeruginosa, gonorrhea, traveler's diarrhea, ciprofloxacin are usually used. All these conditions are caused by gram-negative and should be caused by gram-negative. Some intracellular pathogen like tuberculosis. Then coming to prostatitis and community acquired pneumonia, diabetic foot infection usually by Pseudomonas aeruginosa and anthrax. All these we can prescribe ciprofloxacin. Of the drug will be about 7 to 14 days. They are available in different dosage form, oral, parenteral, and ophthalmic solution. Ophthalmic solution as eye drops. The brand names will include the ciproxin or Bayer. The company will be Bayer and Sicin. Just know there are oral preparation, parenteral preparation, and ophthalmic preparations. Most commonly used fluoroquinolones, which includes levofloxacin. Levofloxacin comes under the third generation of fluoroquinolones, very active against gram-negative and gram-positive, plus Legionella, atypical respiratory pathogens, and Mycobacterium tuberculosis. Their most common indication includes community-acquired pneumonia and chronic bronchitis, plus nosocomial pneumonia and intra-abdominal infections. The adverse effects of levofloxacin. Here, some impairment with glucose can occur in diabetic patients. Again, it can lead to QT prolongation, toxedipoitis, and arrhythmias. The most common nausea, GI upsets are also present here, plus intestinal nephritis. Same as our ciprofloxacin, 2 weeks dosage form should be given. Sorry, 2 weeks the drug should be given, available in the form of oral, parenteral, and ophthalmic solutions. Coming to moxifloxacin. Moxifloxacin, this is not a second generation but third generation along with levofloxacin. Again, the activity is against Streptococcus pneumoniae, gram positive including beta-lactam and macrolide resistant ones. Okay, it is active against pneumonias, bronchitis, sinusitis, and otitis media. Here the spectrum becomes big, that is broad spectrum. Before it was just gram negative with ciprofloxacin. Here it comes to say gram positive as well as gram negative. Now, there were many fluoroquinolones in the market which was later withdrawn from the US market. Let's see what are the reason for that. Uh, mm, Treprafloxacin under the brand name Raxar, because of the very serious cardiac events like QT prolongation and ventricular arrhythmia, they were withdrawn from the market. Sparfloxacin, again the same cardiac toxicity, QT prolongation and phototoxicity, it was withdrawn from the market. Trovafloxacin had hepatic toxicity, which was very severe and again withdrawn from the market. Catifloxacin, increased risk of hypoglycemia and hyperglycemia led to the withdrawal from the market, while norfloxacin due to some commercial reason. But norfloxacin is available in Indian market, while rest of them are very limitedly available. But most first and two are already withdrawn from the market. I have just mentioned about in detail about ciprofloxacin, levofloxacin, and moxifloxacin, which are very commonly used in the market. Please go read the other fluoroquinolones available in the market and the newer one that has come into the market. What are the side effects of the newer ones and extra uses of the newer ones? Okay. Up with the class fluoroquinolones. Under fluoroquinolones, any student should be able to write the mechanism of action, the classification, the pharmacokinetics, plus uses and side effects of fluoroquinolones. These are the five important parts of the answer that should be present when a drug is being asked. If you have any doubt, please be free to ask and please mark your attendance below the YouTube class. Thank you.